All right, I think we're ready to get going. Thank you for your patience. And this meeting is being recorded. If you would like to listen to it later, it should be available. Okay, so I'm Ann Frank. I'm the EMS data manager for the AZ-PIERS system. Most of you have probably talked to or I know. And we're going to get going just because we've shortened our meeting now to be just an hour long after we did a survey on what people are looking for. So I'm going to start off with our Bureau Chief, Rachel Garcia, to do some Bureau updates.
Well, good morning. This is Rachel from the Department of Health Services. Thank you for letting me join the EMSRUG meeting today. We wanted to start by sharing just a couple department updates. I think many of you already subscribe to our listserv, so this will not be news to you, but we have been working on several rulemaking over the last 5 years. And most recently, in the last year, we were able to update our air ambulance rule. And we also, in March, updated our ground ambulance rules. And as part of those updates, I definitely wanted to extend a thank you and gratitude to all the stakeholders that have been along for the ride, attending all of our stakeholder meetings for especially the ground ambulance rule update most recently. Some of the requirements that we're going to talk about today directly relate to the most recent statute and rule changes for our ambulance providers. One of the things to take note of is for all of our air license holders and all of our ground certificate holders, we now have requirements outlined in rule for reporting to Arizona PIERS, our EMS registry. The new requirements, I'm sure this is not a shock to you, follow the EMSRUG version 3.5 requirements. So we are keeping up with national standards as we move forward with reporting to the EMS registry. Of note, the requirement that is in rule is that records shall be reported to the EMS registry within 48 hours of a call. And this is to be as consistent as possible with our data use agreements that have been in place now for what has it been, a decade that we've had our data use agreement in place. So across the nation, all of the states that participate in EMSRUG have data use agreements in place. And of note, those requirements in the data use agreement are actually that we report as a state to EMSRUG within 24 hours. So we are approaching real-time reporting when it comes to AZ-PIERS and then reporting up to EMSRUG at the national level. We thank you all for your participation in AZ-PIERS, our EMS registry here in the state. And again, transitioning to those version 3.5 requirements. It's been a tremendous effort with Ann leading us through that transition. And we just really appreciate all the work you do to provide nearly real-time insight into what is happening in EMS in Arizona, driving forward quality assurance initiatives and really trying to improve patient outcomes here across the state. I think that is the bulk of our most recent updates. If there's time later, I will plug our April 10th Strategic Planning Summit, but I think that is enough from me. I will turn it back to Ann to go through our next agenda item.
Okay, great. Thank you, Rachel. Okay, we're going to kind of move along. I'm going to skip the next small bulleted point on the agenda, but if you have any questions about data format, validation, things like that, everything is posted on our public facing webpage. Within the Bureau's webpage, if you go to the data quality assurance and then AZ-PIERS, there's a bunch of tabs and you'll find all the resources there you need. If you have something that you think should be up there and is missing, please let me know. We can generally develop something and add it to the website. And I'd be happy to do so. I want that to be a good place for everyone to go because, you know, if you're not able to get a hold of someone when you have a question or you don't want to wait to try to, you know, get a hold of someone later, I'd like you to be able to find at least as much as possible the answers to your questions online. Okay. So updating rosters, item 4. So we're just going to talk a little bit about the EMS and Trauma portal. Sometimes it's called the EMS portal. Although a bit confusing, that is actually completely different from AZ-PIERS. So it's also an image trend system. Now, it's the licensing system. It's the one that everybody goes into when you renew your certifications in EMCT and it's
Yeah, I'm here.
okay, great. Sorry. I didn't want to be like Lydia and then you weren't there. And so as part of our transition to the new licensing database and having both systems with the same vendor, they one of the advantages is they can sync to each other certain bits of information so that we all have the same picture on both systems. So you're not going to have kind of one set of people on one and one set of people on the other, and you're not really sure who has access, and then getting access, we don't know who's part of what agency. As there are many other reasons, including like hospitals should be able to see the names of their providers on the forms that they're getting if we have those providers listed in AZ-PIERS. And to do that, it makes a lot more sense rather than every agency having to go into both systems and update their list to just go into the EMCT portal, the EMS portal, and log in and update your agency's rosters. So I know I'm going to pass it over to Lihia in just a moment. She manages our licensing database, and she's just going to talk you through a little bit about updating your rosters. I do know that not just anyone can go in and do it. You have to be like a certain permission group and things like that. But we're really encouraging all agencies, whether or not you are a PON holder, if you provide data to AZ-PIERS, please log in and update your roster. If you have no idea what I'm talking about, it's totally fine. You can email me. I'll connect you with that team. But this is something we'd like to get going. I actually don't think it would be, once we make sure everyone has access, we get over those questions, I don't think it will take a lot of time. And it should be really quick to update as, you know, people join and, you know, retire from your system. So Likia, do you want to?
Yes, so I'll share my screen, shall we? Let's see. Okay, so this is our public portal page. So page. If you scroll down under user guides, we have a guide on how to update the rosters. And then when you click on that guide, it's going to give you all the steps on how to do so. Like Anne was saying, if you need to have a role in order to be able to update the roster. You need to be a coordinator, or we have several other roles that can update the roster. If you are a CON holder, you can reach out to your regional coordinator and they should be able to give you the role that you need. If not, you can reach out to Anna and myself and we can definitely help you out. But once you log into and I'll do a quick demo right here. So if you go into provider, if you have a role, you're going to be able to see the different providers that you have a role with. So for this one, I'm going to go to Test Arizona. I know that I'm a coordinator because I see that I have the blue. So I'll just click on the provider itself. And then you'll be able to have all the options. If you don't have a role assigned to a provider, you won't have that option. So that's a way to know if you have a role. Once you're in the system, if you go to personnel, you'll be able to see everyone that's currently in your roster. If you want to add someone, under this section right here under personnel, you just search for them. And then once they come up, you just search and then you just add to that person. And then you just have to do one by one. In order for the user to be added to the rosters, they need to have an account in the system. So if they don't have an account in the system in EMSRUG, you won't be able to add them into your role. If you want to delete someone, you just select whomever it is. You can do one person or you can do multiple ones. And then at the bottom, you're going to see different options. You're just going to click on remove selector users and click go. And then that's pretty much it. That's how you add and remove someone from your rosters. Any questions?
Hi, this is Chris from Rio Rico Fire. I
Yes.
have a quick question.
Mhm.
When you have like reserve or part-time personnel from another agency, can they be on both agencies or how does that work?
Yeah, they can be on multiple agencies.
All right, perfect. Thanks.
I'll pass it on back to you, Anne.
Okay, thank you. If anybody else has. Yeah, go ahead.
So this is Rachel. I just wanted to make a quick comment and question for the group. Lydia, I think what I'm hearing is that the benefit here is twofold. If you go into the EMS system, that ems.azhs.gov site, you can update your roster in one system and it updates it in full.
Yeah,
AZ-PIERS and the EMS Registry.
that's correct. So at first, we're not thinking it until we can get some agencies to start updating their rosters. But then we will start syncing agencies over, probably in groups, just make sure everything goes okay. And then from then on, when a change is made in the licensing system, it will automatically update the AZ-PIERS system. We're not necessarily going to have everything transfer over and update, but things like certification numbers, whether or not somebody is active in your agency, and so therefore you would want them to have access to your data potentially or not. And things like, I mean, your date of birth probably wouldn't change, but things like that, potentially email addresses. So we're going to kind of pick and choose and at first have just a few things think over, but we may add more as time goes by just to make sure that both systems record the same information.
That's awesome. The one-stop shop, you
Yeah.
update it there, it'll update.
And hopefully it should be pretty, I mean, that's what Lydia's process, I think, showed too, is it should be pretty straightforward. I say that, and you know, if you have any issues at all, we're happy to help. Okay. So, let's move on actually to the next item, which is the main part of our meeting. Because I'm having issues with my computer, which I'm trying to actually solve right now. Could you please, Shelley, go to our website, the AZ-PIERS, and, yep. Okay. Yeah, so under data quality assurance, and everybody, you can follow along too. This is a good thing to know where it is. It's actually posted in two sites. It's gonna be posted in the ground ambulance thing also, but and then go under AZ-PIERS. And then I can't see the tab, sorry. Oh, right in front of me. Okay. And then go under education and tutorials. Right there, sorry, the second row tab, last tab. Okay, and then the bottom item. Right, after I already got my. To reset my password. It's security code. Okay, can everyone see this? And like I said, it's a small. We can try to make it bigger. Okay. And also, if you can open it up, if you're in front of your computer and you can open up a copy of this, not only will you know where it is, but you can read along at whatever magnification you would like, especially if you're, I don't know, on your phone and trying to read it on your phone screen. It's pretty hard to do if it's small. Okay, so I'm going to go through this. What we're covering first, just to orientate you a bit, is, and Rachel, please do step in to clarify anything. So there is a new law in place. One of the requirements is, and I think that it was called House Bill HB 2609. I think it has a new name now, but we've been referring to it as that because it's the way that I think everyone is kind of familiar with it. And one of the requirements that relates to your AZ-PIERS data and your ePCR data is for CON holders. So if you're not a CON holder, this doesn't affect you, although you can actually go in and run this report because we had the data updated for 2023 for all agencies, if you're interested. But this one is the requirement only for CON holders. And Brian and Leah will go over later in the presentation how to upload this report after I go through kind of the background of the report itself and also the requirements behind when and, you know, what you need to include with it and all those things. So the first part is I'm going to go through this response times report. It's a report that we've built within AZ-PIERS that will allow agencies to go in, run the report, and generate for the year 2023 data that will include the urbanicity of each response that was a 911 call, that was either emergent or non-emergent, so it's divided into two groups, and that included just if the vehicle was an ambulance, and so we'll go through some of the details on the population and those kind of items. Okay, I directed the wrong mouse. Okay. Okay, so this has got a lot of details, but one reason we put this together was because a lot of agencies had been asking for the specifics of exactly how the report was built. I'm going to go through it. So the incident date range for that report right now is defaulted from January 1st, 2023 to December 31st, 2023. The years of data that we've actually updated the urbanicity for are only 2022 and 2023. So even if you were to run this on 2024 data for some reason, it's not going to come back with any urbanicities because that has not been processed this time. So if it's within that date range, based on the unit notified by dispatch date time, and the type of service requested is 911 or emergency response primary area, and the response mode to scene is not blank, so it has to be either emergent or one of the other ones fit into the non-emergent group. And the primary role of the unit or equipment capability, depending on which version of data you're working with, indicates the type of ground transport. I'll go through the specific codes. I'm not going to read the codes out later, but just so you can see that they're available to you. Although it would have to have an incident patient dispositions, it indicates an arrival on scene. And it also excludes non-EMS and non-response area type calls. And we did that as best we could. I'll go through that in a minute. Also, we do still have a disclaimer at the top of the report that we've added that indicates that the report may contain out of service or out of area responses, which is just kind of a nice disclaimer in case something was left in there and we tried to exclude it, but maybe depending on who reported your data, it may not be excluded. And I'll go through that also. And then also the incidents, either the incident state indicates Arizona, or the zip code indicates Arizona, or the county indicates that it's an Arizona incident location. So you're trying to include things that if you picked up for some reason in New Mexico or in Utah, it should not be included in this report. All right, so I'm going to go down to just the specific definitions for each one of those things I just went through. So we talked about the unit notified by dispatch date time is used for the date range. It's also going to be used later. We'll talk about for the response time calculation. We are calculating that using this time. So it's an important time. Your record won't make it into our system if you're importing into our system without this time, because it's mandatory. If you're entering directly into our system, I mean, it would be possible for you to be missing it. So that's something to always watch out for. The type of service requested, that's the specific type or category of service that your EMS agency is responding to for that EMS event. So it's an immediate response is what was chosen because that's what is required in the rule. I'm doing it. Okay. And it includes 911 response to scene, if it's 3-4 is what it's called, or emergency response, primary response area on 3-5. For those of you that manage your databases, just so you know, that code, which is what we get when you send us data, that code that's coming over is listed there. The label changed for the value between 3-4 and 3-5, but it's an identical code. And I just want to clarify here, we'll discuss this a little bit later also. Both of these values are actually defined as being within the agency's primary service area. So if you're using this, it should indicate that where you're responding within your primary service area. I realize that was not always the case when people use this, but and that's one reason we put that limitation in there in the report to kind of allow for the fact that not everyone was maybe using this as it was defined. Okay, response mode to scene indicate was the response emergent or non-emergent. We ended up grouping these based on the committee feedback, and if either you have immediate, which is emergent response, or we had a grouping for non-emergent is the non-emergent, emergent downgraded to non-emergent, and non-emergent upgraded to emergent. And there are codes are listed there too. Okay. For the primary role of the unit, that's what it was called in 3.4, and in 3.5, it's the same data element, they just renamed it. Unit transport and equipment capability. There are 4 possible values depending on if you're in 3.4 or 3.5. As you guys probably know, 2023 was a mix of both. So some agencies, there were very few agencies that actually were all on 3.5 for all of 2023, which is why we kind of have this split. For the 2024 data, we're assuming everyone was on 3.5 and all of the data will be just related to the 3.5 value, because it'll be a lot less complicated looking. But so it has to indicate the ground transport. There's ground transport, ALS equipped, ground transport, BLS equipped, or ground transport critical care equipped. Now, remember, this does not mean that the patient was actually transported. That's not the population. It is, they made it to the scene and that it is an ambulance and that it was a 911 call. Then, okay, so one of the other items was the incident patient disposition, which if you're in 3.4, it's e-disposition 12. It's called unit disposition and e-disposition 27. So as most of you are probably familiar, in 3.4, if you ever used that data set, there was one disposition. It had a lot of values with many commas and ors in it. In 3.5, it's been divided into 5 different data elements with fairly short answers. So the type of disposition in either case would indicate that the patient, or sorry, that there was an arrival on scene, but it also would exclude specifically these values. And I divided them between 3.4 and 3.5, and I realized this looks a little overwhelming. So, but any assists, and I listed those there. We eliminated any assists that were coded as this. We eliminated any that are canceled prior. So canceled covered by another unit, canceled prior to arrival on scene, canceled prior to dispatch. Anything that was recorded as a mobile integrated health call, treat and refer, a transfer to telemedicine, those were not included either in this population. Anything that indicates standby, so those values are listed there, or if just operational support was provided. And then any non-EMS call. So if you're transporting organs, if you're in a safe station drug program referral, false call for false alarm. Okay. If you were using 3.5, or for the part of the year that you guys were, we excluded if it was canceled prior to arrival on scene, or if non-patient incident not otherwise listed. Okay, so there was one other bit of information that we included in the report to try to weed out anything that was outside of Arizona, just in case we didn't get it with, including only things in the service area, as best we could. So if you arrive on scene, you should have an incident scene address, or have completed the eScene 11, which is the scene GPS location, which is a lat log. So the location information for where the patient was found, to which the unit responded, It depends, of course, on the scene location to what relevant geographic information you're going to be putting in there. But for the report population, we looked at anything where the incident state, incident zip code, or any other indicator, like county, indicated that it was in Arizona. But for purposes of things like geocoding, if you did not provide one to us, the geocoder is going to look for the street address, the state, the zip code, and either the cross street or the milepost in those fields. I'm going to pause for a second. See if anybody has any questions before I go on, because I know this is a lot of information and I'm not expecting you to memorize it, but you can absolutely look this over and if you have questions later. But does anybody have any questions? Yeah. Okay. So reasons data would have been excluded, and this might come up when you run your report and something doesn't look quite right. One of the things to consider, if the ePCR did not fit this population definition. So when you pull this run and you're gonna be like, wow, that run count is pretty low. Just remember, this is only stuff where it's 911, you know, either emergent or non-emergent, where it was an ambulance and it made it to the scene. So it's weeding out a lot of calls if you're thinking about your total call count. It could be because also certain things weren't filled in quite correctly. I did see some examples, just for purposes of examples, where there were some weird things in the address where the address said California, but then the zip code was an Arizona zip code. So sometimes those made them in, sometimes they didn't. It's just one more thing to kind of make sure you monitor with your data quality. Okay. And then obviously anything that wasn't successfully imported into AZ-PIERS is not going to be in your report. So if we had reports that we sent you over the year saying you're missing some 2023 data and stuff failed, if you did not end up sending in those failed reports later, they're not going to be part of this data population. Okay. So now I'm going to go through just some of the relevant data elements. So we already talked about the ones that are part of the population. Now I'm just going to add the ones in the analysis. So I'll explain what that means. So once we group the population, we kind of said, okay, it's this date, this type of call, this whatever. We have this group of ePCRs. For the system to calculate a response time and give that, you know, as a 90 percentile fractile, it has to have the date time it arrived on the scene. So if it doesn't have that, it can't calculate the time. So that's one of the other things that we were looking for as far as completeness. And that is what is used in the calculation. And then also, I know I mentioned this before, so I won't read through it, but the response mode team was divided into emergent, an emergent table, and a non-emergent, which includes B. Okay. This is one of the things that I really would like us to focus on a little bit. It's one of the first times I think that we've ever used the scene lat-lon if it was provided by the agency in any kind of formal process, which is always a learning experience as to kind of what we're getting. And this is the first year we're doing this report. There's going to be things we're going to find and discover, and we're going to grow and learn together. That's how I see it. So specific incident location. So you kind of had an option with this report to get the urbanicity that we had populated into the system, one of two bits of information, and they had to be obviously accurate bits of information. So option one was that agencies could provide a lat-long coordinates. These are usually either entered by the agency or they're populated by CAD. And then obviously if you don't enter directly into our system, then you're sending that over and we're importing it. That is called ECN 11. It's actually divided into a latitude and a longitude, so two different fields. And if you have provided accurate GPS coordinates, and I put in here what the pattern is. I've learned this. I did not know this before this project, so this was kind of nice to learn. But Arizona GPS locations are going to be within these ranges. You can have some of these combinations, they're still not in Arizona, but if you have a longitude that is outside of this range that you've given us, or you have a latitude that's outside of this range, then it's not going to show it as an Arizona call. And if it doesn't show it as an Arizona call, it will come back as an unknown urbanicity, because the urbanicities were just determined for the entire state of Arizona, because that's where everyone's service area should be, and that would be all that you would be held responsible for. So that's one thing. If you did that, that's option one. If you sent us a lat long, that's fine. That met the criteria. And as long as it was an Arizona one, I mean, if you did pick up in California, it should be outside that range. You would get an unknown if it had somehow made it into the population, like you put California and an Arizona zip code or something like that. Okay. So the other way for us to get this geocoded scene information was if you provided, instead of a GPS, you provided the scene address. So option two, and I'll go over the little part in between in a second, but option two is, depending on the information, you know, what the scene was. If you're on the side of a mountain, you probably gave it the GPS and didn't fill in a street address. But if you're in a city, you generally would have filled in, you know, a street address, and it would have to be correctly formatted, you know, a number and or letter or whatever you're doing to make sure it's the exact right address. That was the information that was then used to create a lat long scene geocode for that ePCR. The reason that's important is for us to move on to the next step of actually figuring out what the urbanicity is. We have to know where the location is, and it has to be based on the lat long, because our map that provides all of these little shapes of what's wilderness and what's rural and what's urban and what's suburban are placed on a map, and depending on where that little pinpoint is that that ePCR scene was, that's how it determines that urbanicity. So the reason this is kind of key is if for some reason the EMS agency has entered their own lat long, then there's nothing wrong with this. It's fine. AZ-PIERS will not use the incident scene address to change that lat long that the agency submitted. So the system is assuming that if it is receiving a geocoded scene information from the agency, it accepts that as the gold standard, and it will not update those incident coordinates based on an address you put in there, even if they're contradictory. So it looks for that scene GPS. If it doesn't have anything filled in those, then it automatically will go to the address and try to provide a lat long from that, and those values are taken, and that's how we determine the urbanicity. So before we move on to the next part, just the definition of urbanicity. Does anybody have any questions?
Okay, hand raised online, Aaron.
First. Okay, Aaron. Do you like to
Yes,
ask a question?
hi, Aaron Seifert, GISIT with Guardian Medical Transport. And we received the report from 2023, had a bunch of locations that were definitely out of that latitude longitude range. And we have our CAD, and we were working through our system trying to figure out why those locations got a bad latitude longitude. But in that report, it was only showing the street address and county, no state or city for that matter. And you just said that the address will not overwrite the latitude longitude. So one question I have is, when we figure out what's going on with our system, what is the process to maybe modify those lat longs to correct them for the historical reporting that is out there?
That is an excellent question, Aaron, and we have actually been discussing this internally. So we don't have a set in stone plan right now. We're working through some options with our vendor. At this point, and I think you kind of have a two-part question here. So you're basically saying, you know, and I really appreciate you bringing this up because I think everyone could benefit from this. If you have some lat longs that are incorrect, that, you know, came in fuzzy, and this is the first time we're looking at this kind of thing and catching it, what about if the address information is also incomplete? Sometimes the geocoding can do a fair amount with an incomplete address, but that is key. If it's going to then, if we were to do something where we could shift to just using the address, if that's incomplete, it also might cause, and I think we have our GIS person here. So he's nodding his head. Yes. Okay. Sorry, because that's not my area. So that if the address information is incomplete, if we were to shift, say, and we can't even do that right now, say, look at that, it wouldn't be necessarily then a correct geocode either. But as far as correcting, we don't know about the 2023 data. We are going to try to work with our vendor and kind of see if there's anything we can functionally redo if you resend that information. So I think the key point to focus on now before we have a really clear answer is, because this is the end of March, that means we're about a quarter into 2024. So the most important part from my perspective is to get that 24 data corrected and resent, because that will impact the next year. And I think this first year, we're expecting that we would find these hiccups if there were any, because for the first time, everyone's examining this data in this minute of a way. We would love for y'all to resend anything that's incorrect from 2023 also. You can work with me. I can generate a report where I can show you all of them. The one that I remember sending to you guys, I think, was just the emergent cases, just so you know. But that is something that I'm happy to do and work with the agencies. We would like corrected data. It would be, and if you resend it, you resend that record, it will overwrite the previous record. So their information will be updated. It won't automatically rerun the urbanicity, and that's the part we're kind of trying to figure out if we can do. But 2024 data has not been, I just want to emphasize this, 2024 data has not been run yet through that whole urbanicity process. So if you can correct any issues in 2024 data with kind of wonky GPS codes, it's kind of before the horse leaves the barn. I don't know. We'll get on it early. So does that answer your question kind of at least where we are now?
Yes. I'll get the specifics on how to resubmit, whether it's NEMSIS or some other way, and I'll contact you offline. The second part of the question was that we know that if we just use our street address, which is listed in that report, that it first geocodes to Ohio. And that's the reason for our, well, it's not the reason, but it's one of the indicators that's the lat long that we had. Now, I suppose in your geocoder process, that when you're assigning urbanicities, that you are using the city, county, and state in your geocoding process, right?
My understanding is, so the actual geocoding, if you don't provide it to us at this point, is done once it's imported. It is done through a process that we already had established with the image trend system, and they use, and I'm going to look at, because I'm going to say the wrong, it's the Google GIS, like a standard.
Okay.
I think it's Google GIS tool they use. But so they don't use county as far as I know, but I used county to try to make sure that I was trying to stick to Arizona when I wasn't getting all of the different bits of information, as you pointed out. So, but what they actually told me exactly is they used street address, believe it was incident, apartment, suite, or room. I don't know how specific that would need to get. City, state, and zip code, and then potentially the cross streets, the mile marker. I realized, and we have been talking to them about this, sometimes, even though the definition for NEMSIS says to put in the closest city when it's not in a city, I know a lot of agencies really don't want to do that when it's not in a city, because that throws off their own numbers. But we should still be able to get a reliable geocode off of, the zip code and the street address, as far as we've seen.
Okay.
Yeah.
And that's why if we provide as an agency the lat long that's used over top of the address, because in theory that lat long has been provided by a CAD system of some kind. Just one thing to note is, of course, Google, no one pays for really, and I believe EMS Charts uses that. It's our charting system. And when we were trying to check some of our common addresses on Route 66, right in the middle of in Flagstaff, they were being geocoded about 4 miles to the east. So there are problems with that data set. And so I guess the emphasis is really to have provide lat longs, because that means it's been geocoded and somehow checked with more local data sets rather than in Google at that point. Okay.
Yeah,
Well,
and
thank you for-
I will double check with Image that was just something they said on a call. They mentioned that, that's where I'm
Sure.
picking that up from. But I wouldn't be able to totally tell you at that level of detail, but I will find that out as to what exactly their process is. We have a meeting with them every week, so I'll get that
Okay.
information out.
But just heads up that since we saw that problem with EMS charts, that it could be the same system used by ImageTrend, and it's just more of an awareness that there are problems with the geocoding since it's not using the state or county geocoding address ranges and such.
And I mean, just to kind of back up for a second, even though for the geocoding, I think we could do it. I really want to emphasize to everyone, we really need the state and county filled in. Because even though for this particular process, we can probably get a decent geocode without it. When we do restrictions, we're looking for just a certain county, or just, we need that information in that area. We're not using the geocode to figure that out. So we do need everyone to please populate state, county, zip code, you know, and then if possible, the city and street address, if it is a street address. But those are super important items that allow us to easily restrict things when people are asking about, you know, what happened in this county or whatever. That's the information we're using, but not in this report. Okay.
We have one more question.
Oh,
Go ahead, Derek.
So I work out in kind of a rural environment. I'm probably an hour or so from the closest hospital. In regards to the geocache, how accurate has it? Because if we get a lot of medical stuff on the highway, say with like accidents and stuff, do we have to put in the milepost? I was reading.
yeah. I mean, that I haven't looked at stuff as far as if we would get the same thing if we did some mileposts. I know our internal GIS has a secondary process they do if that's the information that they have. But if you give us the lat long, that's what we'll use.
No,
Which is, I know some agencies that was their exact thing. They're like, I'm on the side of a mountain. I don't know what my nearest thing is.
right,
So
no,
yeah.
I'm sorry. Does the system automatically generate the latitude longitude, or is that something we have to pull from, like, say, if we use a GPS?
So the system does based off the address if you haven't given us a GPS. But to your point, I don't know if it was, you know, depending on how limited that address information is how well the geocoding software can actually give an accurate lat long.
Right, because in the service area, I mean, I know we do a lot of with the agency I'm with, we do a lot of our medical in town, but we have about roughly 20 miles of highway, up to about 35 miles of roads between Florence and us too, that we go on. So all in all, we probably got 35, 40 miles of highway and some undeveloped roads in the area.
Okay, yeah, we can, I mean, and I can dig into that a little bit more. I haven't seen any specific problems. I have noticed a few issues if the mile markers and things are ending up in the street address and not in the milepost where it's supposed to be. But and what agency are you with? Sorry, Derek.
No, that's fine. I'm with Kearney Volunteer Fire.
Okay, perfect. Okay, so I don't think, yeah, and you and I will have to talk offline because I think you would do, oh, you don't have, never mind. Okay, yeah, yeah, I'll look into that and get back to you because I think that is a good point. We just haven't gotten into what we could do if there's limited information like the mile marker or whatever, or cross streets, and especially if they're put in the field that they're not intended for, how that's coming back. I have a feeling it's probably coming back as unknown, but we can check.
All right.
And then just to move along, because I know we have Brian Leas. We're almost done. I won't read through these, but the definitions of urbanicity are the same as what is in rule. It was in Article 9 previously, and they have not changed to the new Article 9. So, and if you are interested in taking any of your lat longs and sticking them into the urbanicity map that our GIS team created that has all the little polygons. You can open the link, you can put in your lat longs, and it will show you where that is on the map. And then you can look and see what polygon, as far as like if that term urban or rural is based on populations. And then we talked about relevant calculations a little bit. The response time is calculated by on-scene from unit identified by dispatch. 90th percentile, you'll see on the report, that just means the number of minutes, so it's rounded to whole minute, the number of minutes at which 90% of the calls are within that time. So like if the 90th percentile is within 10 minutes, that means 90% of your agency's calls that are in this report have a response time of 10 minutes or less. And then I'm not going to read through this, but just so you know it's here, this is written instructions. The top paragraph is really detailed. The bottom one's just, you know, if you forget, you've already done it, you're like, what is that called again? On how to go into AZ-PIERS, find that report and run it. So you can kind of see what we're talking about. I can't pull up an actual agency's report, and I wasn't able to get a hold of everybody who was interested in letting me show theirs this time, but I'll try to see if I can find someone later. And right now there is a link in here. I'll replace it with an updated link later that's kind of going to talk about some of the instructions that Brian and Lee are going to talk about next. Once you get this report, what do you do with it? So I'm going to pass it on to Brian and Lee.
Oh, question, one hand raised.
Aaron?
Yeah, I guess I could have caught this in the last section, but with the urbanicities, and there, I know there was a lot of work that was done on those urbanicity boundaries over the past couple of years. We are seeing that there's no specific language saying we have to use those specific urbanicities for our reporting, annual reporting. Case in point is that there's large areas around our service area that are actually wilderness, actually federal wilderness, areas that don't have any population at all, can be closed in a moment's notice by the Forest Service, that we can't drive there. And they running the comparison between the accepted urbanicities versus what we're wanting to use, there is actually an improvement in numbers. And so just wanted to ask the question if that's something that can be verified, if we have to use the provided urbanicities, or we can modify what they are shown to what better fits our area.
So just for a point of clarity, because this is something I have in my FAQs, but I'm not able to pull them up because my computer's not working. This report, and I know this is counterintuitive, but this report, this response time report, as part of HB 2609, is actually completely unrelated to the requirements in your CON. Just repeat that to yourself. This is important because it really is otherwise very confusing, because like not everyone has 90th percentiles and every CON is different at this time. And so this report is using what's in rule as far as urbanicities, and it is kind of treating everyone exactly the same. But it is not the report that will be used to evaluate you meeting your response time as part of your CON. And then I'm going to pass it to Rachel for the second.
Yeah, and I so appreciate that question, Aaron, because I understand that your team up in your service area is very technologically advanced. You've been able to look at the data and slice and dice it many different ways. We at the state have, through all of our legal reviews with the Attorney General and our administrative counsel, have had to look at the new requirement under Arizona Revised Statute 362232, which says that annual reporting must include reporting by urban, suburban, rural, and wilderness response time. And so we've taken that language quite literally and had to use the new rules that are in place. The fortunate thing is the new rule did not change the definitions for urban, suburban, rural, and wilderness areas. So as we navigate this together, I just wanted to clarify that we are utilizing the Arizona Revised Statute language that just went into effect in January, and we are referencing what is in rule for those definitions for those urban categories. And with that, let's have Brian and Leah take over and walk us through the next steps of how to upload the report.
Leah, are you gonna share?
Yes.
All right. Okay, so good morning, everybody. This is Brian Hubble. I'm the CEO and Rate Program Manager here at the Bureau. This presentation is really kind of help define, or not define, but give you guys guidance as to how do you guys upload these reports that you guys continually hear about. So we developed a report within Image Trend that allows you guys to submit all three reports that Rachel was just talking about that's related to the 2609 rule and also what's related to your ARCR. Again, those three reports are going to be the annual ARCR. That annual ARCR is still, that's not going to change in regards to when you guys submit that, except for the initial first go around. So we're asking all CO1 holders to submit your all three of these documents, so your annual ARCR. If you've already submitted it to the Bureau, we're asking you to just re-upload that permission back into this application for this first go, and then also upload the report that you're going to pull out of AND system or the AZ-PIERS system, as well as also run your current compliance for the most recent month, for the last 12 months from when you guys submit that. So in this case, it would be pretty much June from 2023 to June of 2024. So those reports we're asking to be put into the system by July 1. Moving forward after that, we're going to ask everybody to then transition to when your ARCR report is due. So for example, if you guys are a fiscal year, your reports would all be due in December. If you guys are on a calendar year, your reports will be due come July 1. Anybody have any questions about that? Okay, perfect. Moving on, when do you guys submit the 2609 report, or I'm sorry, the response time report, or as some people are referring to it, their Venezia report? When you guys submit that, that does become part of a publicly available, and that's something that will be done through the public portal. And I'm going to turn it over to Lucia real quick to walk you guys. How do you guys upload these things in the Image Trend system? And then we'll get right back to some of the questions that we've heard throughout the past few months.
All right. So I'll go really quick over the steps on how to submit the report. Once you log into the system, again, you're going to go into applications. You're going to click on applications. You're going to click on provider view and view provider applications. If you are the coordinator, for multiple agencies, you're going to be able to see them. So just click on the agency that you want to submit the report. You're going to get the list of all the reports. Search for the application to submit annual ACRCs, annual CO and compliance reporting, and annual HB 2609 response time summary report. You won't be able to see it right now because we haven't made the report active. So we'll make that report available later on in April. So that's why you can't see the report right now. But once it's there, you're going to click on apply now. The first page that you're going to see is going to be the provider information. That should auto-populate with all the information that we currently have in the system. To submit the HB 2609 summary report, that's going to be on the 4th tab. If you're also going to submit to submit your ACRC and your CON compliance report, those are going to be in 2 separate tabs as well. So you just, for all of them, you're just going to click upload file and then save and continue. Once you click save and continue for all of them, it's going to take you down to the acknowledgement page. You just click on the 3 boxes to certify. You just enter your password, today's date, and submit the report. And it's pretty simple. If you have completed an application before, it's going to look very familiar, the same steps. We made this very simple. So pretty much, like I said, the only thing that you have to go is in there, just go in there and upload the documents. Any questions on how to upload the reports? Okay, Brian, so back to you.
Perfect. So some of the questions that we received over the past few months, and obviously we've covered some of this, but I thought it'd just be, again, as a quick summary. Again, what is the difference between the 2609 response time summary report versus the CO1 compliance report? Again, the response time summary report, or the urban history report that you guys are are just now getting used to. That is coming out of the AZ-PIERS system, and that's the report that will be publicly available. The CO1 compliance report, that report is the one that you guys are used to when you submit back to the Bureau on your renewals. So did you meet your compliance within your CO1, what's written on your CO1? The second thing that we are hearing again is we wanted to outline the timeframes of when we need these reports. So again, the first round, we're asking all providers to submit all 3 of those documents on July 1st. And then after that, those documents will then start being submitted based on when your ARCR is due, depending on whether it's fiscal or calendar year. Anybody have any questions about that or any other questions that are outside of what you guys are seeing right now? Okay, last part I just want to throw out there is that if you guys find that you're having any issues with the application when we do release it, please reach out to me or my team, and we'll be more than happy to walk you through the process and help kind of like transition it. If you guys have any ideas as you're going through the applications you think that might make it easier, love to hear your opinions as well. Other than that, thank you, Ann.
Okay, does anybody have any questions? I know we're getting close to the end of the meeting time, but maybe have any questions related to what Brian or Lydia just presented? I know we've had a couple agencies that have tried to go in and kind of upload the report, so I don't know if anybody else has already kind of poked around in the system or not. This is in that EMS portal, remember, not with an AZ-PIERS, just
And
be clear.
sorry, one last thing. Okay, we're going to post this on our website, so you guys will also have this as a quick reference so that you don't have to try to remember all the steps.
Great. Thank you, Brian. Thank you, Lydia. So I'm going to move on to the next couple items, which are actually really short. Really, number 6 is just a reminder. So most of the questions I get, or maybe a fair amount of them, where there's some confusion on if you're paying attention to those weekly reports, which hopefully you're getting, and if not, email me, that give you information on your validation scores or like validation rules that have triggered and examples of ePCRs that have these issues. And you're looking at them and you're thinking this doesn't make any sense. And then you're seeing other errors in your system maybe that you're not seeing on those reports and it's contradictory. It may be that you just haven't, or your vendor hasn't, depending on your system, updated your schematron file, the state schematron file since the last time we updated it. So I'm going to send one out probably in another few weeks, hopefully, but it was about a month and a half ago. I think the last time we had a schematron update. That's where the new validation rules are that actually kind of get applied on export from your system, and depending on your vendor, I don't, how it displays. But if you don't keep that updated, it will look different than the report that you get, because I may have changed a rule and now the systems aren't going to match. So just keep that in mind. If that's confusing, talk to me or your vendor and we'll figure it out. Same thing with the validation rules. I post a copy of those. So if you have control over your own rules within your system, your business rules, it's also what they're called, and you want to kind of follow what we're doing, and maybe you even have a stricter business rule because of the type of agency and what you guys do. Maybe there's actually more detail you have in there. There's a change log with each one of those. That shows kind of just the changes that we have made. So if you look at that each time we send out changes and just glance and go, okay, yep, no, you'll know what changes you may or may not want to make within your own system if you do that separately from your schematron. And lastly, and once again, I don't know how it looks in everybody's system, but if you don't know now, I recommend you look into how to determine if your exports aren't actually exporting, because that happens a lot where people think things are exporting and they're actually not. And I will never know because they don't export to me for them to even fail. Or you're exporting them, but they're failing to export. There should be a way in your system for you guys to see something or track something. So you go, oh, look at all those failures. So it doesn't get to be like 2 months down the road and all of a sudden everything kind of blows up. If you're sending ePCRs to us and they're failing on our end, with the exception if you're sending in the wrong agency ID and then it doesn't show on our system report because it doesn't even know what agency it's assigned to. You will eventually get a report from me saying these have failed, but you should be getting some kind of notice back into your own system. I want to give you guys the control here. So that's called posting. Like if you mail a letter, it's posted. So if the posting is unsuccessful or failed or whatever, that means that when you mail that ePCR to us, it's exported successfully, it was rejected for whatever reason. There's something significantly wrong with it according to the, NEMSA schema or the state schema trust. So keep an eye on things. If your stuff's not exporting at all, or not as much as, it should, like maybe half, because that's important. If it's exporting, but it's all failing, or some of it is. And also if it's exporting, but it's coming back saying that it did not successfully post, it failed to post, there could be different terminologies your vendor uses, because all of those are going to mean that we don't have that ePCR in our system. If we don't have it in a system, it's not included in any reports. The hospitals aren't going to see it from our system. It's not going to go to NEMSIS. And we're not necessarily even going to know we're not getting it. And that can be such a headache to try to go back later with your vendor and to try to figure out what didn't go and what failed. It's so much easier to fix things as you go. And that's just a reminder and a recommendation. And I think we're pretty much out of time. So if you have any questions or requests, please do email us and we will be happy to get back to you. I wrote down a couple of the questions from the meeting that I would like to follow up on. And our next meeting is scheduled for June 13th at 10 a.m. It will be once again an hour-long meeting. We may have kind of a specialty meeting in between then and now for a specific kind of subtopic that we talked about, kind of doing it that way for a portion of people that are interested in it so that not everyone has to sit through it. And that is all. Thank you very much for attending the meeting, and please do let all of us know if you have any questions. We'd be happy to assist you.
Thanks, everybody.
Bye-bye.
Very much.
Thank you, bye.